Understanding and addressing health disparities is more urgent than ever right now as we're dealing with the COVID-19 pandemic. Today, we're joined now by former U.S. Surgeon General Dr. Regina Benjamin. Dr. Benjamin is currently on the board of the American Heart Association. So thank you, Dr. Benjamin, for taking the time to talk with us this morning.
Thank you for having me.
Dr. Benjamin, we've been reporting on the disproportionately high rates of coronavirus-related deaths, specifically among African Americans, the U.S. Hispanic communities, and in rural populations as well here in our country. So that begs the question, why? Why is it that these groups are dying at a higher rate from COVID-19?
You know, in the early days of this pandemic, we talked about the fact that elderly and people with underlying health conditions were at higher risk. Most of us took that to think of elderly people, people with cancer, people with HIV and other kind of chronic conditions. But it really also meant people with diabetes, high blood pressure, pre-diabetes, even if they're not taking medications, asthma, things that fairly healthy people are walking around doing. Those are also at higher risk. And what we're finding is that we weren't surprised to see that people with those conditions were starting to get the virus more frequently. But what we weren't really prepared for was that they would be much sicker, they would get sicker faster, and that they would die more often. And so that is very troubling. And the American Heart Association has been noticing that people with underlying cardiovascular disease, particularly cardiac arrhythmias, things like irregular heartbeats, are being affected more. And so we put in $2.5 million to fund rapid research to find out if there's anything that we can do to stop this, or is there any reason for this? And so we're making those funds available to researchers for that.
Yeah, and we know the research is obviously in high demand as we're trying to get answers as quickly and as efficiently as possible. And, you know, how are social factors putting other vulnerable, under-resourced communities at higher risk as this disease continues to spread from the big cities to the rural areas?
So like the social determinants of health, as we talk about, things like education, your financial health is directly related to your physical health. All of these things are important. And as you've probably heard, your genetic code, your zip code is a better predictor than your genetic code of your health outcomes. And so it's not necessarily that it's the African Americans or the Hispanics or as a population or genetics, it's more of these social determinants. So we're seeing the same thing in rural communities like mine, where we have high blood pressure, where we have heart disease, we have increased or obesity, things that lead to heart disease, strokes. Those we're seeing here as well. And so we're just as much at risk. And so these social determinants is what really is a major contributor of heart disease. And we've been talking about that for years. So what we try to do is figure out how we can start to address some of these. And hopefully on the other end, we will know how that we can prevent those preconditions and cardiovascular disease.
Yeah, it's all about the prevention at this point in the game, and we appreciate you taking the time to speak with us. If you're just tuning in, we've been speaking with the former U.S. Surgeon General, Regina Jackson. Thank you so much for your time, and we'll continue to look for updates on all the research that you're doing.
Thank you very much.